All right, folks. We do have another speaker coming up here shortly. In fact, right now, we're really at the 10 o'clock mark. Our next speaker is Chuck Phillip. Chuck, are you in the building? You're there. Okay, so great. Chuck is here. And Chuck is going to be talking about home care and home health, making the right choice. Chuck Phillip is with the Alpine Physical Therapy, and his wife Chuck and his wife Kathy have been owners of Alpine Physical Therapy for the last 8 years and started Alpine PT Home Care in 2020. Prior to this, Chuck served as an executive vice president of 3 different companies in the medical device industry for 25 years. And as we're waiting for Chuck to get mic'd up here, just a reminder, if you get hungry at some point, we do have a food truck here today. Eats and Sweets will have a food truck out front. And again, we've got all of our vendors, each one of our speakers here today has a booth, and will be just down the hall. And so when we inevitably with these run out of time at the end, and people have a lot of questions. So if you do have more questions, you can always follow up with all the speakers directly one-on-one at their booth. And Chuck, typical format here, what we're doing is about 20 minutes of speaking and then roughly 5 or 10 minutes of Q&A, trying to wrap up a couple minutes before the switch up so there's time to turn over. And if you'd be kind enough to repeat, if anyone asks questions, to repeat the questions so that it's caught on the microphone. When people are speaking from the back, it's not caught on the mic. So great. And with that, Chuck, take it away. All right.
Let's see. And we got to get this back to the beginning there. Yeah, we need to move it back to the first. Let's see if this is going to... Looks like it started going. Okay. Got it. I'm going to get over here on this side. Okay. As he already introduced me, I'm Chuck Phillip. I'm the CEO of Alpine Physical Therapy. Well, this thing is just going crazy here. Try that again. Alpine Physical Therapy provides 2 different... What's going on with this keeps moving every time. Should we disable this? Because I can also hit the button. That's okay. See, it keeps changing slides all the time. It's all right? Do you want me to press a button each time? Yeah. Okay. All right. It's still changing. Let's do it that way. Go back to the first one. Okay. Let's see if it works. Okay. Alpine Physical Therapy has 2 different clinics in Longmont. We also started Alpine PT Home Care last year. Right at the beginning of the pandemic, there were a lot of people that decided they wanted to stay home. They didn't want to leave their house. They still needed physical therapy. So we said, well, there's a lot of need for, and there was a lot of demand at the time for physical therapy in home. So we began the process of going through setting up Alpine Physical Therapy, Alpine PT Home Care, which provides care, nursing and physical therapy at home. I put a picture of golf on there because golf is my passion, and I thought, well, I needed to have one picture of that on my slide, so that's the only reason that's there. Let's see, let me get this. Okay. One of the things that I learned, and I thought I knew a lot, but apparently I don't know as much as I thought I knew. There are 2 different aspects to home care. One is home care, which is non-medical care for people that are receiving either companion care we'll go into more details about this. It's usually non-skilled medical care at home. Home health is medical care, which is nursing, physical therapy, speech, occupational therapy, and those type of things. So there's a big difference. And when you're going out there and you're searching on Google and thinking, well, I need home health, you're probably going to end up with a lot of home care in there as well, because a lot of all of us make a mistake of calling everything home care. I need some home care, but that means a lot of different things. One of my first mistakes was, as not knowing any better, was I said, well, let's just name it, we already have Alpine Physical Therapy. We'll name this Alpine PT Home Care. Well, it should have been Alpine PT Home Health, because the business that we have is home health. But anyway, I'm learning as I go along there more about the differences, and that's what I'm going to talk about a little bit now. A little more about home care. Home care provides a lot of the different things that are up here. So, and depending on what you need for someone to come in and do, they do a lot of that. Grocery shopping, meal preparation, laundry, errands, visiting angels, home watch caregivers, Always Best Care. A lot of those companies provide home care. So usually people come in home care, they'll spend anywhere from an hour to a few hours, a few days a week. It really depends on what you need as far as that goes. And they'll even offer 24-hour care as well, if that's what you need. So there's a lot of different aspects to home care as far as that goes. Home health is a lot about nursing. I'll give you some statistics later about nursing and how much nursing versus physical therapy. Many times someone may leave the hospital and the main thing they need in the initial time is nursing, whether that maybe it's IVs, it might be vital sign checks, it might be wound care. So there's a lot of different things on the nursing side that are needed. Therapy, if you've had a knee replacement or a hip replacement, many times 2 to 4 weeks out, you're going to need home health before you can come to a physical therapy clinic and get, maybe therapy outside the home. So a lot of post-surgical. We do a lot of support for people that have balance issues. So if someone needs help in the home with improving balance, strengthening, and that type of thing, that's something we also offer. Occupational speech, pain management. Typically, home health will come in and spend 30 minutes to an hour of 2 or 3 days a week. So with our home health agency, we assign a therapist, for example, to come to your home, and they'll set up a schedule with you that works with you for you to be able to have them come to your home and treat you for whichever condition that is best for you to be treated for. What you're looking for in home health, typically an agency not too far from where you live. Most time, with Alpine PT Home Care, we cover Boulder County. We're based in Longmont, so we also cover the southern edges of Weld County and Larimer County too. That's a part of our license. And the agency needs to be licensed in the county where you live. So if you live in Boulder County, they need to be licensed by the state in that county, for example. There are ways to find home health, whether it's recommendations from other people you know that are using a home health agency. There's what's called the Boulder County Blue Book, which has a lot of resources for seniors related to a lot of different things, but they have a whole section on home care agencies and home health agencies. Typically, a doctor or a hospital will need to refer you. So when we get a call from someone that says, I want home health, the first thing we ask them is, have you got an order from your doctor? Without an order from your doctor, home health can't come take care of you. So that's a critical part of the whole thing, is the doctor referral. Make sure that the agency has caregivers available. Many home health agencies right now, and home care is typical on this as well with the agencies we've talked to. Many of them are really stressed when it comes to having caregivers available. So one of the questions you should ask is, do you have anyone available for what I need? Because they may or may not, depending on what the situation is right now with the staffing shortages around the country and in our counties as well. It's been an issue. Insurance reimbursement is a big deal. When you're looking for a home health agency, you also need to know that they provide care and under whatever insurance that you have. Most of us all have Medicare, so that's a key. But many people have a supplemental to Medicare, like United Health or Anthem. And then some people have a replacement plan, which is United Health comes first and Medicare goes second. So you need to, and different agencies can take different insurances. Not all agencies can take all insurances. So one of your first questions also needs to be, do you take my insurance the way that I have it set up for me? So that's a key part of it as well. It is possible. A lot of home health agencies will also work with home care agencies because you may need grocery shopping from someone on one day. Home health doesn't do that. And you may need physical therapy on another day. So home health and two agencies usually work together and start communicating on, to make sure not everybody's coming at the same time to take care of you. Home health agencies, according to the new state regulations and now coming out the federal regulations, anyone that comes to your home has to be vaccinated. It's not necessarily our home health agency's rules. It's the federal government, the state and federal governments now have come out with those rules. So rest assured, if someone's coming to your home, they've been vaccinated. They're following the protocols. There's a lot of things that a caregiver needs to do when they come into your home related to setting out what they call a sterile barrier, making sure they don't put things in places where there's any potential for any transmission in your home. They'll wear a mask. You don't have to wear a mask. It's up to you, but the home caregiver will definitely be wearing a mask. There are different places where home health agencies go. We go to homes, we go to assisted living facilities, and other similar facilities like that. So if you're not in your home, you're in an assisted living facility, we still come to your place wherever you are as far as that goes. So one of the things I like to look at as a definition is home care helps you with your daily living, making a meal and those kind of things. Home health helps you heal, helps you get better so that you can get out of your house and do the things that you like to do. As I mentioned before, how to get home health, doctor referral. You don't have to. Many doctors will say, well, I'm going to write your referral to go to this agency or that agency. If you know an agency that you really like or you've heard is good, tell your doctor, I don't want to go there, I want to go over here. The doctor doesn't have to, you don't have to do exactly what the doctor says as far as the agency goes. You can go to the place that you would like to go as far as that is concerned. Make sure that verify insurance, plan ahead for surgeries. If you're going to have knee replacement, I would highly recommend that you start looking into home health and getting an appointment set up as soon as you know when your surgery is going to be scheduled, because these home health agencies and our physical therapy clinics are booked 2 or 3 weeks out many times. So you don't want to wait till the last minute to make your appointments for home health. And if the surgery moves, the agency will move their schedules, but at least you have something on the calendar as far as that goes. So that's important. And many home health agencies, in our case, we have an outpatient PT clinic as well. So if you had knee replacement and you're in the home being treated for 2 to 4 weeks, then you can potentially follow the PT to the clinic as well. So a lot of our PTs go back and forth between in the clinic and at home. So we're able to provide both as far as that's concerned. Just a few statistics. There's over 12,000 home health agencies in the United States. The industry has been growing rapidly. All of us are getting older. All of us need different types of care. The industry is now almost $400 billion in terms of the actual industry itself. In terms of home health, about 84% of the time nursing is included, about 40% of the time physical therapy is included, 14% OT, 14% wound care. Over 60% of the home health patients are female. Maybe the ladies live a little longer. They need, they need more home health longer. 87% of the caregivers that come into your home are female also. So, and in general, the home health, because it's such a broad geography, for example, we cover Weld, Larimer, Boulder County. That's a lot of space. And home health givers and caregivers sometimes travel 20 to 50 miles to be able to see a patient. And over the course of time, that's 5 billion miles a year. So substantial amount of miles. And that's it. Does anybody have any questions about this? Awesome. Thank you.
What's your location and what's your specific locations in Longmont?
We with our physical therapy clinics, what's the locations in Longmont was the question. We have 2 physical therapy clinics. One is just off of Mountain View and Main Street. So we're on the back side of Longmont Athletic Club, if you happen to know where that is. And then we have a second clinic going out on 119 toward Frederick and Firestone in that direction. Our home health agency is just down the street from our main clinic on Mountain View. So they're all close by. Yeah. Yes, ma'am.
If you have a long-term care health policy, it would depend on that, on what it would do as to what it would cover here as far as home health, right? Do you deal with any of that?
Yes, we do. And you, again, the question is about long-term care and how that insurance plays in. We would need to check your insurance with your policy and we are treating a patient right now who has a long-term care policy. So there's different factors involved, but the home health agency should be able to look at that for you and find out.
In most cases, you are approved for that kind. If you're approved
Yes.
for Medicare,
Then you would definitely be approved for that. Yes, you can be approved for as long as you have Medicare, you're approved for just about all the care.
Okay. And as to whether or not, I have to check my long-term care. If it means long-term health, I didn't realize health and home care are 2 different things.
Yeah, and that's the thing that we all misunderstand is home care and home health. And so when we're out there searching for things, we end up searching for. What I used to do is search for home care, and I'd say, oh, who's out there doing home care? Not the same in terms of what you need or what they treat.
But they can be not combined exactly, but they work with each other.
They do work with each other. There are a few. There's 1 or 2 agencies, I believe, that provide home health and home care. But there's not many that do that. They're usually either one or the other, as far as that goes.
Okay.
Yeah.
And that would just require some investigation.
Yes, I think a few questions and a few calls, and you can get some answers on that for sure.
Good.
Yeah. Yes, ma'am.
Do you deal with all kinds of people? Do you deal with dementia and Alzheimer's and that?
Yes. The question was, do you deal with dementia and Alzheimer's? And with our agency, there are agencies that do that. With our agency, we treat more what you would need related to those conditions for nursing, for physical therapy, maybe for occupational therapy as well. So if you need other treatments around dementia and those type things, then there may be a different type of agency that would need to do that. So, but there are a lot of people that have a lot of issues related to physical therapy that come from those conditions. So we can treat those.
Would your Alpine physical therapy come, or would they have to get home care to come and do these treatments for dementia patients?
Depends on what the treatment is, but we could. Yeah. The question is, would we be able to come do treatments related to dementia and Alzheimer's? We could, depending on what the condition that is. If it's really treating dementia itself, we would be looking probably more toward a nurse providing that is specialized in that area that could do that. So.
Mental health therapy.
Or in some cases, if it's mental health that's needed, we would refer that to someone that provides the mental health therapy, for sure. Yeah, we don't provide, typically home health agencies don't do a lot in the mental health area, so we would need to refer that to another agency.
Somebody that would
Yes.
provide that service.
Yes, we'd stay connected with the different, agencies that provide different things, so we would stay connected with them.
But if you just wanted someone to come and stay with a person, so
Mhm.
you could do that.
We don't typically do that. That's more home care agencies. We're usually in and out within about an hour with treatment for physical therapy or nursing and that. If you need someone that's going to come and stay, the home care agencies provide that. So that would be Visiting Angels or someone like that could do that.
Okay.
Yeah. Yeah. Yes, sir.
Do you provide case management?
We case management with the doctor is part of what we do. So we would do a case management for each patient. That's kind of in the beginning when we initially eval the patient, we'll do case management in conjunction with the doctor. So.
I mean more, I don't mean medical case management, I mean like social work.
Oh, social work. We would refer that for sure on the social side.
Do you have connection with a social work agency that would accept Medicare?
I don't know off the top of my head. I would talk to some of our staff. Know a couple of agencies that do. I can't think of any myself, but there are agencies that we can refer to on that. Yeah. Yeah. Okay. Sorry about that. Thank you very much. I appreciate it. Feel free to stop by and visit our table. We've got more information there.